Now we are going to discuss about sedative hypnotics classification. Sedative hypnotics drug classification. In that, okay, I will make it very simple. First write benzodiazepines. In the benzodiazepines you have hypnotics and you have anti-anxiety, and also you have anticonvulsants. Okay, here in the three there are common drugs. One is diazepam, again write diazepam, again write diazepam. This drug is common in three. And lorazepam, lorazepam, lorazepam. And there is drug which is common in these two, and there is one drug which is common in these two. First, this one, you have clonazepam and clonazepam, and only one drug here, that is clobazepam. What are the common? Diazepam, 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 lorazepam, 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 clonazepam, clonazepam, and here clobazepam. And one more thing, don't write these orders exactly. Write in this order only: hypnotics, anti-anxiety, and anticonvulsant. If you write this one here, you will get confused. Okay. And the drug which is common in these two is alprazolam, alprazolam, alprazolam. Okay. And then here you can write flurazepam and nitrazepam, and here you can write oxazepam. Okay, diazepam, lorazepam, alprazolam, flurazepam, nitrazepam, diazepam, lorazepam, clonazepam, alprazolam, oxazepam, diazepam, lorazepam, clonazepam, clobazepam. And here, if you remember, you have to write one more. This is also somewhat important: chlordiazepoxide. Okay, I hope you got the benzodiazepines. And now barbiturates. Okay, this is chlordiazepoxide. Here barbiturates, we have long, short, ultra short. In the long we have phenobarbital, again phenobarbital. You might have a doubt, how can one drug be in long and short? I will tell in the class while discussing about these drugs. Now learn the classification. Long, phenobarbital, phenobarbital. In the ultra short you have methohexitone, here butobarbital, methohexitone, and also here thiopentone. Okay, phenobarbital, phenobarbital, methohexitone, butobarbital, thiopentone. This is the barbiturates. And one more you have, that is non-benzodiazepines. In the non-benzodiazepines you have zopiclone, and again you write zopiclone. To this add SES, zopiclone, and you can write zolpidem. Okay, this zopiclone, azopiclone. First we are writing zopiclone, zopiclone, and we are adding ES and zolpidem. And then we have orexin antagonists. In this, write orexant, orexant. Here you write lemborexant and SUV car, you know, right? SUV, suvorexant, lemborexant. These are orexin antagonists. And after orexin you have melatonin okay, in melatonin conjuncts you have first write melatonin itself, okay, and then write melatonin. For this melatonin add agomelatine. Non-benzodiazepines, we had written zopiclone, and we had written S and zolpidem. In orexin antagonist we have written orexant, and we have written SUV and lemb. And melatonin conjuncts we had written melatonin itself, and agomelatine. This is the second one. Melatonin we had written and add ago, and these are all the drugs. Now we'll go with the mechanism of action of benzodiazepines. First, let me draw the GABA receptor where the benzodiazepines act. This is the GABA receptor. Try to draw along with me so that it will be easy. Okay, this is the gamma subunit, this is the alpha subunit, this is the beta subunit, this is the alpha beta subunit. Okay, the subunits are not that important, but remember, whenever there is GABA, this is the GABA receptor, and whenever the GABA comes here, it opens this chlorine channel. This is the chlorine channel, GABA mediated chlorine channel. So whenever this GABA comes and attaches here, this is the GABA A receptor. This total is the GABA receptor which mediates the chlorine channel opening and closing. Now whenever this GABA comes and attaches in the GABA A receptor, this chlorine channel will be opened and there will be influx of chlorine inside. Till now it is very clear. This is the GABA receptor, and whenever this GABA comes and attaches in the GABA A receptor, the chlorine channel will be opened and there will be chlorine inside coming. Till now we are okay, we are understood. Now this benzodiazepines receptor is this. Okay, now you have to surely write this sentence: GABA facilitatory action. Okay, what? Benzodiazepines. That means this benzodiazepines will help the GABA. That means it will make the chlorine channel opening frequency more time. Only I am telling frequency of opening. For suppose if it is opening 1 or 2 times without benzodiazepines, whenever this benzodiazepines is given, it will open 3 or 4 times. For example, I am telling this one. That means the number of times it opens is increased. The number of times it get activated and it will allow chlorine influx. The number of times it is increased. Okay, now we understood frequency. That is, benzodiazepines are going in the GABA receptor and they are binding in the allosteric site of the GABA receptor, that is in the benzodiazepine receptor. Okay, I think you confused here. This is the GABA receptor, and in the GABA receptor there is benzodiazepine receptor. Now this is total GABA, but you have here in the GABA receptor also have benzodiazepine receptor, and also you will have here barbiturate receptor. Don't get confused, this total is GABA receptor, total, but here the GABA binds, and this is the allosteric site. Here what will bind? One of the allosteric site, benzodiazepine, will bind. That allosteric site name is benzodiazepine receptor, and this here we have barbiturate. This barbiturate will bind in the barbiturate site. Okay, this one is finished. Now if I tell the barbiturate, you will understand very better what is this frequency and GABA facilitator action. See, this barbiturate GABA mimetic. What is GABA mimetic? That means here GABA it is facilitating the GABA receptor. Here GABA mimetic, that means it is acting like GABA. That means these barbiturates, whenever they are binded in the barbiturate receptor, they will prolong the opening of chlorine channel. See, if this chlorine channel is opened, it will make the duration of opened chlorine channel more. The duration is increased. Here the frequency is increased, but here the duration is increased. It is GABA mimetic action. This is duration increase, but here frequency, the number of times it is opening is increased. But even though it is here, if it is in the first without barbiturates, if it opened for example 1 second, in the second whenever give barbiturates, it will open for 5 seconds. That means the time in which it is open, it will be increased. That means more chlorine influx at a time. But here some in the frequency some amount of chlorine only going, but it is on more frequency, means the number of times are increased. Okay, this is the GABA mimetic action, this is the GABA facilitatory action. We now understood about the mechanism of action of benzodiazepines, and here I will tell one more thing. Flumazenil. This flumazenil is the antidote for benzodiazepine poisoning. Okay, this is the mechanism of action. We'll go with the pharmacological actions. Here we have anti-anxiety action, sedative action, hypnotic action, muscle relaxation action, and anterograde amnesia. Okay, NESIA. Here we are having anti-anxiety action. This all mediated through GABA only. GABA is, because GABA is increased, we have decreased anxiety and sedative property and hypnotic action and muscle relaxation action and anterograde amnesia. What is this anterograde amnesia? Whenever we see something, they will be processed in the frontal brain and they will be stored as our memory. But whenever we take the drug, we'll be seeing the things but we can't remember after the drug effect. For example, I had took benzodiazepine, for example midazolam. Now in this I am seeing the board, right? I can see this, okay, there is board and something it is written, but after the drug effect is reduced, I can't remember, oh, I had told a class. Okay, I can't do that. That is anterograde amnesia, and the drug is midazolam. Midazolam can give this anterograde amnesia effect. We did not discuss this in our benzodiazepine classification. Why? It is they are in general anesthetics. They are also benzodiazepines, but it is used as anesthetic, so we classify it there, so that we did not discuss in this benzodiazepine classification. Okay, now I will write here for midazolam. Okay, and coming to the therapeutic uses, see, I personally remember like this. In a if the patient want to use this benzodiazepines, he should be having some anxiety disorders, right? So if he have super anxiety, he will be having quarreling with in his family, right? So related to family, this anxiety patients will have some things. So I can write Mbbs. I remember like this. It is family, but the mnemonic came like this. So Mbbs. Related to the topic, if we take the mnemonic from the topic itself, we will not have a clash between mnemonics of different topics. So I remember like this. F for febrile seizures, and anxiety disorders, muscle spasm, insomnia, alcohol withdrawal, pre-anesthetic medication, and also status epilepticus. we can use in status epilepticus, pre-anesthetic medication, alcohol withdrawal, insomnia, muscle spasm, anxiety disorders, febrile seizures. Anxiety, we know why. Febrile seizures also, there will be increased electronal firing, right? So that will be decreased, so we can control the seizures also. In the muscle spasm, we are having muscle relaxation action, so we can use in muscle spasm. And insomnia, that is the time required to get into sleep, it will be cleared. And alcohol withdrawal, see, whenever you take alcohol, it will depress CNS, right? And it will give that clumsy feeling. So this benzodiazepines also do the same. So whenever the person have tendency or he wanted to drink alcohol, this can be used also. This can also be used, alcohol withdrawal, as pre-anesthetic medication. For example, midazolam. This anterograde amnesia will work here now. See, whenever the person is having a dental surgery, he is instructed to open his mouth, and that all there will be instruments, right? That instruments, that sound, that everything creates a terrific scene there, because that screw type thing will be rotating, right? So it will be like someone is coming to war on us. So that terrific effect, if after the surgery he remember that fear will be there in that patient, right? After the surgery also he might get nightmares about the same thing. So this anterograde amnesia works here. How? As this midazolam gives anterograde amnesia, it gives anterograde amnesia, this one only, and it also gives sedative action and anxiolysis. It will decrease the anxiety, it will give anterograde amnesia, it will give sedative action. In the anterograde amnesia, if the patient can see but he can't remember after the treatment, so that he will not have the terrific scenes while he is sleeping or any other time. After the procedure, he will be forgetting everything, but his past memories will not be affected. His past memories will be preserved, but the things which happened during this drug effect will be decreased. That is some 20 to 30 minutes range. And pre-anesthetic medication, status epilepticus, whenever the seizures are continuous for 5 minutes without gaining consciousness, it will go into this condition. We can use here also, and we'll be discussing about this keenly about after this. And now we completed pharmacological actions and therapeutic uses, right? We'll go with adverse drug reactions. It is causing sedation, though, so there might be excess sedation. I am telling the trick. How can we remember from the past what we had written? So how can we generate the adverse drug reactions? And this, in this muscle relaxation, we can also write from here contraindications. Here muscle relaxation said that they're right, so we cannot give in myasthenia gravis. Why? There is already problem in contraction and relaxation. So if you give again muscle relaxation, how the condition will be cured? So you have to keep an eye while you are giving in this patient. And respiratory depression, respiratory depressed patients, okay, and sleep apnea. See here, to the respiration to occur, there should be contraction properly, but what we are doing, relaxation. And one more, in the sleep apnea, what is sleep apnea actually? While the person is sleeping, normally will take breathing and will not suddenly wake up. But what happened here in the sleep apnea, the patient while he is sleeping, the person while he is sleeping, he will suddenly get loss of breath. He cannot breathe, the air will not enter. Why? Because if this is the throat, this muscle, this area will be closed like this due to this muscle's relaxation. So this will be closed, right? No air passage. So what happens? The person suddenly wakes, suddenly gains consciousness. So after gaining sudden consciousness, the brain will activate and they will retract these muscles towards upwards, so that he will have normal breathing again. This is called sleep apnea. And we should keep an eye while we should not, this is contraindicated actually, sleep apnea. Why? He is already having relaxation and it is obstructing the airway. So if again you give relaxations, it will be more exaggerated, right? So that is the thing. Okay, those are the contraindications, only 3. And in the adverse drug reactions, you can write dependence. Without this drug, he might not get sleep again if he is continuously taking these drugs, and he might have withdrawal symptoms, memory loss. In chronic use, you might also land up in memory loss and drowsiness. Okay, excess sedation, you might land up in dependence, withdrawal symptoms, memory loss, drowsiness, and ataxia might happen. What is ataxia? Due to action on cerebellum, there will be unsteady movements. He will have this ataxia problem. And mostly these are the adverse drug reactions. We had completed most of the things about benzodiazepines, and I will be telling about status epilepticus in our next video. Thank you.